Today we're going to be doing a procedure called the Palomar Icon MaxG Laser. This is really great for taking care of reds and browns and evening out skin tone. It's a very powerful laser, and as you can see over here, we've got some broken blood vessels and a little bit of pigmentary abnormalities. And basically, studies have shown if you get 1 to 3 of these treatments per year, which are really affordable, really quick, and just a great way to revitalize your face, what happens is it builds collagen over time, evens out your skin tone, and is a great procedure. So let's get started. So it's not painful, it just goes on, and it uses the power of light energy to help remove pigmentary abnormalities in the top layers of our skin, so the epidermis. The epidermis, what happens with time is that the epidermis, or the top layer of our skin, develops some pigmentation. And so we start feeling a little bit ruddy, we don't feel as bright as we used to. And what this does is it uses visible light energy to target those pigmentary abnormalities and reverse them. So a lot of times what people get after the treatment is some crusting or darkening of the darker spots. And we just ask that patients don't pick that off. And just moisturize it. My favorite moisturizer after this Icon IPL procedure is using a vitamin C serum. Vitamin C is great. Why? Because number one, is an antioxidant, and it really helps with oxidative damage on the skin, but also because it's a skin brightener. And skin brighteners, what they do is they help over time lift off the dead pigmentation and reverse the abnormal pigment deposition. And the other thing is, it's just a really good, nice moisturizer, and it heals the skin. So we all know we take vitamin C for our immune system. Well, it's no different for the skin. We use it, and it's a great thing to use after any kind of laser procedure. Really, most procedures on the skin, we have our patients post-treat with vitamin C serums. The thing to know about vitamin C serums is that they're not all created equal. So we know vitamin C is ascorbic acid, and so with ascorbic acid, what happens is, just like when you cut a peach open, if you don't have that peach before it browns within the first 10 minutes, what happens is it oxidizes and it loses its vitamin C content, so it's not as potent. So it's important to have a vitamin C serum that is of good quality, that is in a dark, opaque bottle, and that is kept closed, because we don't want any extra oxygen on there destroying our healthy, fresh vitamin C. Procedure has minimal downtime. So we're doing this on our patient, and she's just probably gonna go back to work or go to lunch with her friends and have a regular day. Takes about 10 minutes per area of the body. We're gonna be doing her face, neck, and the V of her chest. And why do we typically do those areas? Well, those are the sun exposed areas. So those are the areas that get the pigmentation and get the sun damage and get the loss of collagen due to UV radiation. So we're gonna reverse that. Typically patients come in once every 2 to 4 weeks, and they get a treatment series of about 3 treatments, and after that, once a quarter or once every 6 months. It's not something you continue forever. It's something that once you get your series, you just maintain it a couple times a year for the best results. And how do we keep our results? Is that we stay on a really good maintenance regimen. And so the best maintenance regimen is a really good sunscreen, SPF 30 or higher, a really good antioxidant, and typically for patients with pigmentation, a vitamin C serum or another strong antioxidant is the way to go. A glycolic acid pad, I like it in the exfoliative pad form. The patients are able to exfoliate their face a couple nights per week. Of course, avoiding the first few days, because we don't want to unroof any crusting from this procedure if it happens. And it's a very mild pepper crust. It's just a little bit of a darkening of the spots that can sometimes occur. And we just want them to naturally exfoliate off for the first week. And after the first week, we can then do a little light glycolic pad to help it along. And the last thing that should really be on our skin is a good retinol. And retinols come in over-the-counter form and prescription forms. I like the prescription forms, they're more potent. And we typically do that for patients? Prescribe back to patients after about a month or two of being on a really good sunblock, because retinols can make you super sensitive to the sun. The other thing that retinols can do is they can really dry out your skin if you're not using them properly. So what's the proper use of a retinol? Proper use of a retinol is if we moisturize before we apply it, and if we wait to apply a retinol for at least 15 minutes after washing our skin. So if people aren't waiting, they're putting it on right after they're washing their skin, and they're not moisturizing before they put it on, they experience flaking and dryness and say, oh, I think I'm allergic to that. I think it just doesn't work for me. And the reality is that it's just nobody has counseled them, or they haven't followed through with applying it properly. And once you do that, it works great. And the reason we need to do that is because retinols act deep down in the skin, and they're irritating to that top layer of that epidermis. And so when we wash our skin, we remove the natural oils on the epidermis. And so we want to wait for some of those natural oils to come back. So we wait 15 minutes after washing. And we also help it along with moisturizing before we apply a retinol, which is very different than any of the other prescriptions that we typically prescribe for patients. Usually it's prescriptions first and moisturizer or sunscreen second, but that's not the case with retinol for the reasons we discussed. You doing okay? Great. Yeah. And otherwise, it's a very quick, easy, and fun procedure. I get these done once every 3 months. I think I'm due. Painless. Awesome. Just what you like. Great. And we're all ready